LASIK has revolutionized the field of vision correction. But what kind of eye condition can actually be treated by LASIK? First up is nearsightedness or myopia. People with this condition struggle to see the objects at a distance. But with LASIK, the cornea is reshaped to correct the way light enters your eyes, and distant objects become clear again. Next, we have farsightedness or hyperopia. This is the reverse of myopia. Close-up objects appear blurry. LASIK can fix this too by altering the cornea's curvature, bringing near objects into sharper focus. Then there's astigmatism, where your cornea isn't perfectly round, causing distorted vision. LASIK can smoothen out these irregularities to provide a sharper vision. Mixed astigmatism is a bit more complex, where you can be both nearsighted and farsighted in different visual meridians. But even this can be corrected with LASIK, giving you a balanced vision. Finally, we come to irregular astigmatism, a condition that was once difficult to treat. But thanks to advances in topography-guided LASIK, we can now correct even this complex condition, offering hope for crystal clear vision for many more people. LASIK's transformative effect on vision correction has been truly game-changing, whether it's nearsightedness, farsightedness, or any form of astigmatism. There's a good chance LASIK can help.